Hi, my name is Joan Erickson. I want to thank you for your time today. I work with your 3M representative and help out with patient warming and the Bair Hugger system. My goal today is to help you understand redistribution temperature drop, unintended hypothermia from anesthesia, and the adverse effects associated. I also want to help you better understand 3M Bair Hugger therapy, how Bair Hugger blankets are different, and which blankets to use for different procedures. The induction of anesthesia plays the greatest role in contributing to unplanned hypothermia in surgical patients. Human studies have shown that core temperature can drop 1.6 degrees Celsius in the first hour of general anesthesia. 81% of this temperature decrease is due to corticoperiphery heat redistribution, which results in the phenomenon called redistribution temperature drop. Anesthesia causes vasodilation, or an opening of the arterial shunts, allowing the warm blood from the core to flow freely and mix with a colder periphery. As the blood circulates, it cools until returning back to the heart, where it causes a drop in core temperature. This is known as heat redistribution. Perioperative hypothermia is defined in humans as any core temperature less than 36 degrees Celsius or 96.8 degrees Fahrenheit. Dogs and cats run temperatures a few degrees higher than humans, but go through the same phenomenon. According to the American Kennel Club, normal temperature for dogs is around 101 to 102.5 degrees Fahrenheit. Unintended perioperative hypothermia has been called a frequent preventable complication of surgery. Unless preventative measures are taken, unintended perioperative hypothermia occurs in 50% to 90% of all surgical patients. Research shows that even mild hypothermia can result in significant negative outcomes. The benefits of maintaining normothermia have been thoroughly researched and documented in independent, peer-reviewed studies. A number of these studies are randomized, controlled studies that document the importance of preventing hypothermia. In a landmark meta-study performed by Chris Brown Mahoney, she captured the essence of earlier research which identified dramatic decreases in complication rates and the related patient care costs that can be avoided by keeping patients normothermic. Normothermia is a process improvement that touches the entire patient care algorithm. This meta-analysis of 18 studies covering 1,575 patients identified reductions in patient costs in several different areas when normothermia is maintained, such as a reduction in the use of blood products, shortened length of hospital stay, decreased ICU time, reduced rate of wound infection, decreased likelihood of myocardial infarction, and lower mortality rates. Who should be warm that are under anesthesia? All shown here are at risk for avoidable unintended hypothermia. Anesthetized patients can't regulate their temperature. Convective warming systems and conductive warming systems warm the patient in very different ways. Convective warms via delivering warm air direct to the patient's skin, while conductive warming warms via direct contact with the patient's skin. As you can see here, convective warming provides for an even overall heat exchange. As you can see in this comparison, 3M Bair Hugger blankets provide for a constant safe temperature with warm air directly to the patient. Overbody blankets do not reach pressure points, and underbody blankets prevent pressure points by the patient's weight. Fluid outlets in the underbody blankets also prevent fluids from pooling on the patient, which can have a cooling effect. With Bair Hugger blankets, you will not have water leaks that you may experience from water mattress systems. The blankets are disposable, so no maintenance, meaning no chemicals to purchase or labor to pay to clean them. Because the Bair Hugger blankets are single-use, it eliminates the risk of cross-contamination. Some of the bacteria is very difficult to kill. Can your customers be confident Their cleaning method is killing all of the bacteria it may come in contact with. Not all forced air blankets are equal. Many do not have perforations in the blanket and so are merely warming conductively or passively. Some forced air blankets have perforations but are not throughout the entire blanket or evenly placed. Another key feature of the Bair Hugger blanket is the manifold channel system, which distributes the warm air evenly throughout the blanket. Other blankets have tubular channels or are quilt-like and may not transfer heat as evenly as the Bair Hugger blanket. Bair Hugger blankets come in 7 different styles. This provides a nice selection to choose a blanket that is most appropriate for the procedure and helpful for the clinician. Bair Hugger overbody blankets come in 4 different sizes. The dimensions on the brochure will help you decide which ones to recommend for your customer according to animal size. Overbody blankets are perfect for dentals or working on one end or the other where the remainder of the animal can stay covered. The underbody blankets are perfect for OR where they need more access to the animal. So for instance, spays, neuters, abdominal, exploratory, etc. underbodies are great for these. Please remember to inform your customer they come with 2 clear plastic drapes. Many of the clinicians like these drapes as they are clear and they can see the animal underneath. Unique to our underbody blankets are drain holes so fluids do not pool on the animal and this can cause cooling. Instead, the fluids drain through to the table. Remember, this is unique to Bair Hugger blankets. One note, there are 2 hose ports on the underbody blanket. There is 1 card covering one of the hose ports. Please remember to instruct your customer to use the hose port that is most convenient for them and to use the card to cover the other port so the warm air does not escape from that port. This has confused many of our customers. And the long blanket wraps around the patient and tapes to the table. This style also comes with 2 clear plastic drapes. Some of the prominent improvements with the newer model 775 are hose end temperature sensing. Not only are there temperature sensors in the unit, but also at the hose end, and the reading is taken as the hose enters the blanket. 2 fan speeds, so along with the temperature setting, the user can choose a higher or lower fan speed. This model also is a little quieter than our older 505. This is very important to clinicians, and I've heard from many customers complimenting us on how much quieter the Bair Hugger warming units are to some of the other models out in the industry. You got questions or want to discuss any of this further? Give me a call or shoot me an email. I'd love to work with you. Thanks again for your time.